Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. We take pride in being your trusted source for quality CEU content. With over 2 decades of experience in providing educational courses, our goal is to help you enhance your knowledge and expand your skill set. Featuring over 250 speakers, 900 courses, and 3,500 hours of continuing education, we are committed to delivering the best educational experience possible. My name is Donna Chow, and I will be your host and your moderator for today's webinar, and I'm delighted to guide you through today's session. Today's class is titled Shingles Treatment with Acupuncture and Herbal Formulas, presented by Dr. Julie Armstrong. This webinar is part of our series of new herbal CEU webinars for the year. Chinese herbal medicine doesn't always receive much attention in TCM healthcare, so we hope that webinars like this will help experienced herbal professionals in refining their skills and beginners in embarking on their professional journeys. Today's class will run from 10 to 2 p.m. Pacific time with 1 break. And before we begin, let me highlight some important Zoom features. First, we have our chat room. It's an excellent tool for connecting with your colleagues and our speakers. So we do ask that you set your chat preference to everyone so that everyone can be part of the conversation. Secondly is our Q&A box, is where you can ask questions to the speaker. We do ask that you limit your questions to relevant topics to ensure an organized and efficient session. And lastly, for those who qualify, the CEU quiz will be available on the following workday, and I will send an email out when it's ready, so do look out for that. Our speaker today is Julie Armstrong, a licensed acupuncturist in Arizona and California. Dr. Armstrong specializes in TCM for chronic disorders, scalp and kinetic acupuncture for neural rehabilitation, gynecology, and pediatrics. She combines her deep knowledge of physiology and medicine, intuitive sense from her Reiki practice, and the determination of a mother challenging the big pharma mindset to provide natural care for her son and thousands of patients. This combination of medical knowledge, Reiki, and passion consistently leads to successful outcomes for patients and a thriving practice year after year. Let's dive into today's session and discover something new. Dr. Armstrong, we are excited to see what you have in store for us, so we do invite you now to go ahead and share your PowerPoint presentation. Let's get started, guys.
Thank you, Donna. Hello, everyone. I see a lot of folks tuning in from California. If you want to put in your chat box where you're coming from, I saw one from Wisconsin. I'm from California myself. Here, I'm going to share my screen here. All right, can everybody see my screen?
We do, but not the full screen for some reason.
Okay, let me try again.
All right.
All right, are you seeing my screen now?
Yep.
Great. All right. So welcome. Thank you. I'm excited for this presentation. So today we'll be talking about shingles or herpes zoster. I've had a number of patients who have come in with active shingles, also a number of patients who have come in with postherpetic neuralgia. And I've had a lot of great success in treating shingles. Postherpetic neuralgia is quite difficult to treat. I don't know if you all have treated that yourself. If you want to comment on that, I'd be happy to hear about that. Because PHN is so difficult to treat, that prompted me to want to talk about shingles and try to get more education out there for practitioners and for patients themselves that we can treat shingles very successfully, and the earlier the better. So today, if you see my outline here, I'll just give a brief introduction about myself and my why of why I'm doing this. And we'll talk about shingles, the background, what it is, how prevalent it is in the United States, its etiology and pathogenesis, the different stages of the disease, the different patterns that it can take on, some complications that we have seen with shingles, also what Western medicine is doing for shingles, And then we'll dive into the Chinese medical perspective. So looking at the etiology and pathogenesis from a TCM mindset, go over a differential diagnosis of what types of patterns to be looking for. And then we'll go into the treatment principles and strategies that I use in my clinic in Tucson, Arizona. Also then how to educate your patients of when to come in and when to seek treatment and what to look for. And then we'll have some time for questions. And I have provided my reference list in case anybody's interested in diving deeper into this topic. So if we move forward, just to give you a little introduction to me, I almost 27 years ago, I had my first child. His name's Joe. He's there on the left of your screen. We had a very severe birth complication. I was full term, but he was losing oxygen. We had an abruption of the placenta, and he lost oxygen for 2 hours while inside of me, which is pretty amazing that he's even alive, to be honest. And so this led me into my journey. They weren't sure how Joe would be, if he would live, if he would die, how disabled he would be. He ended up being quite disabled. And he had a very severe form of seizure disorder, in which, as a newborn, they prescribed him phenobarbital. And if any of you are aware about what phenobarbital is like, it is a barbiturate, a hallucinogenic drug, very toxic to the liver and kidneys. And I was really not happy with giving him that medication. I thought it was really quite strange to give my newborn child a hallucinogenic drug. And so that is when I found Chinese medicine. I researched and I found a doctor in my area in Los Angeles who was able to prescribe me Chinese herbs in order to eliminate his seizure activity, as opposed to just controlling it with this harmful drug. So I went ahead and weaned him off of the phenobarbital, and I gave him these Chinese herbs. To the dismay of my current pediatrician that I was seeing, the pediatrician told me that if I did this, I was the worst mother he ever met in his life, which I was taken aback by, because I was just trying to do something different that was, less harmful to my child. And I found a new doctor who was supportive of me doing this. So he went from having severe epileptic form seizures while medicated, while asleep, not being stimulated, to 3 months later, not being on medication. He had finished his herbal regimen. He was awake, being stimulated, zero seizure activity. So this started me on my journey with him. And I continued to use Chinese medicine for him for a number of issues, which helped him tremendously. And I've had to fight along the way quite a bit to the traditional Western doctors. I've had Child Protective Services called on me. I've had Adult Protective Services called on me for not doing what they deemed necessary for him. For example, antibiotics. I was able to give him herbs for treating some minor infections, which worked well. But I've had to fight. I've put up a fight. Like I said, he's almost 27 now. So it's been a long journey. And then to talk about my why for this topic. So one of the reasons I chose shingles is my own experience, but also, you see, that's my daughter on the right. She's my fifth child. And when she was 1, she had her MMR vaccination, and she, that evening, became unresponsive and went into seizures. And so because of this, I called 911. She was turning blue. She was lethargic. It was a very scary situation. And she was put into a medically induced coma that lasted several days. We almost lost her. Very, very scary event for your 1-year-old. And it was determined that she did have an adverse event to the MMR vaccine. So that's my why. I wonder what what your why is. I know a lot of us in this profession are doing this because of our own experience, either in Western or Eastern medicine. And so I always wonder, what is your why? And so if you want to type in the chat box what your why is, I'd love to see that as well. So that's a little background on me. Since having those experiences, having that experience with my oldest son anyway, I decided to become a biomedical engineer. I wanted to fix his brain. I wanted to develop a brain implant that would carry on the neurological function that was lost when he was apoxic in utero. I worked on these devices, worked on brain implants for motor control. Also, I worked on neuroimplantable stimulators, little micro stimulators about the size of a grain of rice that could potentially reanimate paralyzed limbs. And so this really became my passion. I started working in the industry after getting my bachelor's and master's of science in biomedical engineering at the University of California. I got into clinical trials and device development. I worked on these and at some point decided, I do not want to implant my son with these things. They were very invasive. They were having a lot of complications. The industry itself had a lot of issues that I just, as a single mom of then 3 children, I decided that this journey needed to end. And my doctor of Chinese medicine had been encouraging me to study acupuncture because it was helping my son Joe so much. So I decided to take a few classes in Chinese medicine, really just as a hobby to see, as a scientist, how does this work? I was very curious. But I took a few classes and just fell in love with the medicine. And so I just kept going. I received my master's of science from Dongguk University in Los Angeles, and then got my doctorate in acupuncture and Chinese medicine from Pacific College. I've been practicing here in Tucson for about 10 years. I helped create this practice, Envision Wellness. We're a thriving practice. And I enjoy every single day I come to work. I tell my patients Monday is my favorite day of the week because I love just being here and seeing the miracles that happen with this medicine. So that's just a little bit about me. If we now just dive in to this shingles presentation. I'm sure many of you are familiar with shingles. Name for scientific purposes, herpes zoster, right? Our common name being shingles. This comes from the varicella zoster virus or human herpes type 3 virus. It's characterized by a painful rash. Usually it will create a blister that could start to vasculate or ooze. Usually it affects 1 or 2 dermatomes. It can be more. I have seen more than 2, but typically it is 1 or 2 dermatomes arising from the spinal column. These rashes can occur in many different areas on the body. The most common being on the back. We see that quite frequently. Here you can see some examples of the rash. Again, very, very painful, burning, tingling, excruciating, as patients have described. These rashes can also be on the chest. We see that frequently. They can also be on the face. Hope you're not eating breakfast right now. That is a little bit of a gross picture there, but it can get really bad. And if it goes untreated, it can start to develop scar tissue and a chronic disease called postherpetic neuralgia or PHN, which again, if any of you have tried to treat that, it is quite difficult to treat. So the primary infection actually comes from the varicella zoster virus comes from the same virus as the chickenpox. And so most of us who are of the older generations did get chickenpox as a child. There has been vaccinations that have developed in the last 20 years. But the chickenpox virus, it comes on as a rash all over the body. This chickenpox virus will then go dormant. So it tends to go latent in mainly the dorsal root ganglia of the spinal column, but it can be in the cranial nerve, the autonomic ganglia in the gut. Also, it can go latent in astrocytes throughout the body. This virus, as it goes latent, it just kind of hides and waits for an opportunity to be reactivated and to rear its ugly head as a shingle. And so this typically will happen after age 30. It's less common in younger folks, but it has been becoming more common, which I'll talk about shortly. So this virus is reactivated by a number of factors. It can be reactivated by stress. It could be reactivated by exhaustion, overworking, overplaying. It can be caused by illness. Those that have diabetes are more susceptible as well. And it has been shown that there are certain vaccines, specifically to include the COVID-19 vaccine, that actually does reactivate the varicella zoster virus as well. So we're seeing more and more cases lately after these new vaccines have been developed. Also, we see it in immunocompromised individuals or those on immunosuppressants. So how do we get this? If you did not have the primary infection of chickenpox virus, you are more susceptible if you are in contact with somebody who does have active herpes zoster or an active shingles case. The contagious period, unfortunately, does start before sores start to form. And this is through inhalation of the droplets. So if there is anyone who is near you, if you do notice you have shingles, if there's anyone around you who did not have chickenpox as a child, they are very susceptible to inhaling this. And so it's really important that education gets taken to patients and to the public so that doesn't get contracted by those who did not have chickenpox prior to this. If you did have chickenpox prior to being in contact with this person, you do already have the antibodies and the immune response to fight it. So you are safer from not contracting that from the person directly. And so you have a little bit more leeway as far as interacting with that individual. This infection can also be transferred via the placenta. And so if the mother had chickenpox and she developed shingles while pregnant, that's okay. Because she does have the antibodies, the baby will be okay. It is not life-threatening. However, if the mother did not have the chickenpox virus, and this is a new case for her, that can be life-threatening to the fetus. And so treatment does need to be taken quite quickly. So how does the virus work? How does it express? And this, really talking from a very physiological perspective, there has been shown to be this protein, an immunoglobulin called nectin-1. This nectin-1 immunoglobulin has been shown to facilitate the entry of the herpes virus. It's like glue for cellular adhesions. So when nerve cells come together and they're trying to interact with each other, there's this protein or immunoglobulin that helps them to combine. And nectin-1 is one of those immunoglobulins. This immunoglobulin is in a lot of different medications and vaccines. Pharmaceutical companies use it to help the vaccine or the medication to be present at the nerve cell, to be able to cross that blood-brain barrier. So this Nectin-1, I would encourage people to watch out for, to read labels in the vaccines that you're going to take or in the medications you're going to take, to see if this Nectin-1 is part of the immunoglobulin presence, because it has been shown that this Nectin-1 does foster the viral entry, and it's been shown that there are more folks with an increase in this Nectin-1 that have developed the herpes zoster virus than those who have less Nectin-1. So that's just something to think about. Once the varicella zoster virus enters into the nerve cells, it infects the neurons and it starts to express itself, and it starts to generate proteins. These proteins start to replicate in the neuronal cell bodies, and then strands of those cell bodies, of the virus actually sheds from the cell bodies. It sheds and travels down the nerve to the dermatome that it's associated with. So for example, if the dorsal root ganglion in the cranial nerve, in the cranial vertebrae of the neck, is where it's gone dormant, then it will be reactivated and likely start to cause shingles around the neck and into the face. This virus promotes inflammation and blistering or vasculation of the skin, and that's when you start to see sores develop. The pain associated with this inflammation of the nerves is quite significant. If you've treated anyone with shingles, they are in absolute agony. So definitely something that you want to treat as soon as possible. There's quite a number of folks who do contract this yearly, approximately 1 million individuals per year in the US. That number has actually increased quite dramatically. That number, I believe, is from pre-2019. And we see that in healthy young individuals, that number is less than in those over 65. So those who are, say, in their 20s, healthy, they have a less likely incidence rate, about 1.2 to 3.4 per 1,000 people. After the age of 65, it's more like 4 to 12 per 1,000 people. So it does become more prevalent as we age, as our immune systems weaken. And there was a 2019 study that evaluated incidence from 2011 to 2016, and that came out with a group of people over 50 who had an incidence more like 10 per 1,000. They suggest that there was 8.2 about percent of those people who had some severe complications, 0.8% who were hospitalized. And there are deaths that are associated with this as well.